Hey there, and welcome. If you're joining us for this explainer today, chances are you or someone you love is navigating the often complex world of fertility care. And let's be totally honest, stepping into a clinic and just getting hit with a flurry of medical acronyms, it can feel incredibly overwhelming. But take a deep breath because you are definitely not alone in this. We're going to walk through this together. We're taking that heavy medical jargon and turning it into clear, empowering knowledge. Specifically, we're looking at a very common, very helpful evaluation tool called the SHG test. My goal by the time we wrap up is to replace any of that anxiety you might be feeling with absolute clarity and confidence.
So, here's our roadmap for the explainer. First, understanding the SHG test. Second, finding your underlying causes. Third, a step-by-step procedure guide. Fourth, safety and comfort facts. And finally, empowering your fertility journey.
All right, let's jump right into part 1, understanding the SHG test.
You know, it's so common in medicine to just get handed an acronym and expected to know exactly what it means. It's the kind of question you might have been Googling late at night. What exactly is an SHG? It sounds highly technical, right? And when you're already dealing with the emotional weight of a fertility journey, a complex medical term is literally the last thing you need. But the reality of what this test actually is incredibly simple and honestly pretty fascinating.
Let's unpack this. SHG stands for Sonohysterogram. Kind of a mouthful, but simply put, it's an ultrasound scan test. That's really it, an ultrasound. It's used to evaluate the reproductive organs right within the female pelvis. To get a really crystal clear look at the inside of the womb, the uterus, the doctor uses a very thin catheter to gently introduce a small amount of sterile fluid. This fluid acts almost like a contrast tool. It clearly outlines the cavity of the uterus on the ultrasound screen, which allows your medical team to see absolutely everything in wonderful detail.
Moving right along to Section 2, finding your underlying causes.
Doctors rely on the SHG test to pinpoint the root causes behind some deeply challenging conditions. If you've been experiencing irregular uterine bleeding, recurrent miscarriages, or infertility, your doctor might recommend this test. And I just want to pause here for a second and validate how exhausting and heartbreaking those experiences can be. Going through them takes immense strength. The real beauty of the SHG is that it's a proactive tool designed specifically to investigate why these things are happening, so you and your doctor can finally get some real, actionable answers.
So what are they looking for? Well, the SHG can reveal an abnormal shape of the uterus. It can spot irregular growths, which, by the way, are often just benign polyps or fibroids. It can also identify the presence of scar tissue. Now, I know hearing that you might have one of these conditions might sound a bit scary at first, but finding these isn't bad news. It's actually a massive moment of discovery. You're finding the missing puzzle pieces. Once your doctor can clearly see a polyp or some scar tissue, they can map out a specific, highly effective treatment plan for your personal fertility journey.
All right, Section 3, your step-by-step procedure guide.
For a lot of folks, the biggest source of anxiety before any medical test is simply the unknown. Not knowing what's going to happen when you walk through those clinic doors. So let's just completely remove that mystery right now. First up, timing. Scheduling this correctly is super important. Generally, an SHG is performed right after the completion of your menstrual cycle. However, if you're someone who isn't menstruating, maybe you're postmenopausal, or you're currently on medications that suppress your cycle, the test can actually be performed at any time. Your clinic will work closely with you to find that perfect window.
Once you're in the room, the whole procedure happens in 4 calm, really structured steps. Step 1. The doctor begins with a standard vaginal ultrasound evaluation just to get a good baseline look. Step 2. A very thin catheter is gently introduced through the cervix and into the uterine cavity. Step 3. A sterile saline solution is inserted through that catheter right into the uterus. And Step 4. The ultrasound scanning is performed again. Because the uterus is now filled with that clear saline solution, the walls and the cavity are perfectly outlined on the monitor. It essentially just puffs up the space a tiny bit, just enough so the doctor can visualize any of those polyps, fibroids, or scar tissue we talked about a minute ago.
And honestly, here is the absolute best, most comforting fact of all, straight from the medical experts. This test generally takes less than 30 minutes. That's the whole shebang. It is not a long, drawn-out ordeal. It's a quick, highly effective evaluation that gives you and your doctor a total wealth of vital information in just half an hour.
Which brings us to Section 4, safety and comfort facts.
The SHG is generally a very safe procedure, but, it is a physical test. So let's talk realistically about what to expect. On the side of common sensations, it is totally normal that you might experience some minor cramps or mild pain during the procedure as that fluid enters the uterus. A lot of women say it feels pretty similar to typical menstrual cramping. On the side of risks, there's a very rare but potentially severe complication you should be aware of, and that's pelvic infection. Clinics follow incredibly strict sterile protocols to prevent this, for sure. But your doctor will always make sure you know the exact signs to watch out for, just to be absolutely safe.
And you'll love this point. This is an outpatient test, meaning there are no overnight hospital stays, there's no heavy general anesthesia to recover from for days. It's entirely designed around getting you the scan you need and then getting you straight back to the comfort of your own home so you can relax for the rest of the day.
Finally, Section 5, Empowering Your Fertility Journey.
The biggest takeaway here is this. Diagnosing any abnormalities inside the cavity of the womb is a vital, totally proactive step toward improving your chances to conceive. Knowledge really is power. By having a team of experienced doctors advise you and perform this test, you are actively taking charge of your health. You are literally illuminating the path forward.
And that brings us to our final thought for this explainer. Now that the fear of the unknown is completely out of the way, how will unlocking the exact details of your uterine health change the next chapter of your fertility story? By understanding the SHG test today, you've already taken a massive step toward advocating for your own care. You've got the knowledge, you know what to expect, and you are ready for whatever comes next. Thank you so much for hanging out and exploring this with me today. Keep asking those great questions, keep seeking clarity, and above all, stay empowered on your journey.